Hi, welcome to this talk on a condition that you cannot afford to miss. Giant cell arteritis, GCA, sometimes called temporal arteritis, is an inflammatory condition that attacks the blood vessels, causing progressive narrowing of the lumen, leading to ischemia. Sadly, if you miss this condition, your patient can go blind in one or both eyes and potentially die. The typical patient is 50 years or older, like this lady here. This lady, who usually lives a healthy and active life, came to see me one day. She told me that she doesn't feel too good. In the last few weeks, she has been experiencing increasing fatigue and exhaustion to a level that she spends most of the day sitting or lying down. She describes neck and shoulder pain. She thinks she has the flu. She mentions jaw claudication and tongue pain when chewing. On top of this, she can't comb her hair as her scalp is so sensitive. What could this be? As soon as she mentioned tender scalp from combing her hair, jaw claudication and tongue pain, I knew this was serious. When I examined her, I noted a tender left temporal artery. This should always prompt us to assess visual acuity in each eye, as well as examining the optic disc. If an eye is affected by GCA, then the visual acuity will be markedly reduced, and the optic disc will be pale and swollen. This is because the optic nerve has infarcted due to GCA. Immediate investigations must include both ESR and CRP, as either one or the other or both may be elevated in GCA. A full blood count may also show elevated platelets. Immediate treatment with oral or intravenous steroids is the most important management, as it protects against vision loss in the other eye and can be life-saving. Do not delay treatment by waiting for the ESR-CRP. Clinical history is highly specific and sensitive for GCA, and a temporal artery biopsy can be undertaken up to a week after commencing steroids. If there is vision loss, then urgent referral to ED needs to happen. But if there is no vision loss, then commencing steroids, investigations, and liaising with a rheumatologist is best practice. Think about giant cell arteritis in a patient with jaw claudication, scalp pain, and loss of appetite. Be mindful that the absence of a headache doesn't mean you can rule out GCA. Over the next few weeks to months, the steroid can be reduced as symptoms improve. Steroids are usually given for long periods, 12 to 18 months, with the aim of cure. This is very much dependent on the state of symptoms, such as any vision loss. Remember to think about bones and diabetes with long-term steroid use. So, in summary, if some or all of the following are present, then suspect GCA and treat and refer immediately. Age greater than 50. Localizing headache that is not pre-existing. Temporal artery tenderness or reduced pulsation. Jaw claudication. Scalp pain. Tongue pain. Vision disturbance. Thank you for listening.